You're listening to the Toe Talks podcast. Today, we bring awareness to the atrocities that hospitalized patients endured during the scam-demic, the inhumane practices, egos, discrimination, and medical failures that were perpetrated on patients by the medical community itself. We will spotlight how healthcare professionals stopped critically thinking, stopped practicing evidence-based medicine, and stopped allowing for bodily autonomy. Hospital administrators told physicians how to practice medicine while holding their jobs as leverage, and exchanged the health of human beings for governmental, pharmaceutical, blood money. Stick around. You're not going to want to miss it. We are the rugged, authentic savvy, and you're in the right place. Live free, pursue health. Powerful living starts in 3, 2, 1.
They have basically kidnapped him. I nearly got arrested.
So this is how they get them in the hospital. And then they get them to get admitted. And then they kill them. Need some prayer. It's getting real fast.
I've worked 20 years for a hospital. This is not how you treat people.
What you are about to hear is a very raw and very personal story about the COVID hospital ovens. We must tell our stories, and the world must never forget them. But we won't stop there. We'll chat about the good that can be found in the evil and the important takeaways that can be gleaned from the events that unfolded in the fall of 2021. Welcome to the Toe Talks podcast, episode 9, part 2, the hospital ovens and patient prisoners. I'm your host, Dr. Toe. Today we're going to pick up where we left off in our story. Both Lee and I were sick with COVID, but Lee especially, and he was beginning to have breathing problems, and Lee was kidnapped by the hospital. I left the hospital. It was probably about 1:30. Went home, was on the phone on and off with Lee. And you got to remember, from here on out, I was armchair quarterbacking it. We were separated. We did not see each other until he was released from the hospital. Very difficult.
Hello, family. I can't tell you how freaking mad I am right now. I knew that as soon as I got a phone call from these people who are supposed to give him the antibody infusion treatment, telling me that they were taking him to the emergency room. And I said, they will let me in, right? And of course they said, oh yeah, sure. Because he has COVID, they won't let me in to see him. So they have basically kidnapped him. I nearly got arrested. They told me he was being treated. And I said, if I call him right now and he's not being treated, y'all just lied to me. And of course I call him and he's not being treated. He is on oxygen right now and he's going for a chest x-ray, which we wanted yesterday and couldn't get because he tested positive for COVID. Is any of this making sense to you all? Do you see the game that they're playing right now? You think I'm delirious, but I'm not. I'm crystal clear right now. I've worked 20 years for a hospital. This is not how you treat people. I'm going to wait for the chest x-ray to come back. I'm going to see what the doctor has to say. And if all they have to say to me is, we're just going to have to keep him on oxygen, and he probably should be admitted to the hospital. I'm going to tell him to take a freaking jump into the lake and wheel my husband back out to me now, because the freaking protocols for the hospitals are killing people. They put them on remdesivir and a ventilator, and they die. Sorry, I'm being really honest right now, but you all need to know what is going on, and it is not right. Prayers for everybody. Thank you.
Right after that voice text, I texted my good friend who lives in Georgia, and I was a little bit more forthcoming, let's just say, on some of the details that had just transpired.
Well, I nearly got arrested because I knew they lied to me when they told me that I could come back and see him in the emergency room. Total bold-faced lie. I knew it. They lied to me. Because, of course, when I go to the emergency room, no, you can't go back because he's got COVID. And Well, it's our rule. It's a sucky rule, and I don't care. You need to bring me back now. Well, we're going to call the police. Call them. And they came, and they were nice. I was not nice. They started to explain to me the levels in the hospital. I'm like, I freaking work for the hospital. I said, bring my husband out here now. Well, he's getting treated right now. No, he's not. I just talked to him. Yes, he is. I go, you're lying to me. You need to let me back. They told me that they would let me back when they were escorting him over here. Well, it's our rule. And I'm like, I don't care if it's your... It makes no sense. I live with a man. I should be able to stay in the freaking same room as him. So now you're telling me that he's on oxygen. They've ordered a chest x-ray, which we wanted yesterday, but couldn't get because he got tested positive for COVID. So he goes for the monoclonal antibody treatment infusion today because he got tested positive. And then I get told that he can't get the infusion because his O2 is too low and he has to see a physician in order to get it. Well, you lied to me again because now he's in the emergency room. A physician has looked at him. He's on O2 and getting a chest x-ray, and that is all they're doing for him right now. So are you going to give him the infusion or not? I mean, what the hell is going on? This is unbelievable. Oh my gosh. I'm so fit to be tied right now. I'm so fed up with this whole charade. I don't even know what to say anymore.
It was about 2:45 p.m. that day that he had finally gotten the x-ray that he couldn't get because he had COVID. Now he's in the hospital getting the x-ray. He had to go to the ER to get an x-ray, which I guess maybe is what we probably should have done in the first place, but then he would have been kidnapped anyway. He didn't get the antibody infusion, and they kept lying to us all throughout this process because I was told if he gets admitted to the hospital, he can have the antibody infusion. Because I'm like, hey, this is the whole reason why we're here. Let's get this infusion going. Never happened because they said, oh, we can't give it to him because his oxygen saturation is too low, and we need a physician's approval in order to give him this infusion. I'm thinking, okay, well, let's do it.
Yeah, you would think.
But I think that was God's protection. Never happened, but something that was very frustrating because they lied, because eventually they said, no, we can't give it to him. And I think part of it was because the possible side effects from these infusions causing respiratory issues. I digress. So let's keep going forward. And he was in the hospital, no infusion, got an x-ray. The x-ray came back for COVID lung. I think that's the same term as pneumonia. Hello. Anyway.
Everything changed with COVID.
That's a different story altogether. We'll talk about that as we go along. I was texting him, and a while went by that it was probably about an hour that I didn't get a response from him. And so I finally called him and I said, hey, what are they doing for you? He said, oh, well, I finally got budesonide. I'm like, thank you. That's great. What else are they doing for you? Well, I have an IV. And I'm like, oh, well, what's the IV?
I just assumed a normal IV feeding me and giving me, liquid.
So it turns out it was remdesivir. And I was so mad that he had remdesivir going through into his veins. I hung up on him. Okay, I agree. Not the best moment for Dr. Toe here. I obviously called him right back afterwards because I was like, what am I doing?
But at that point, I had said, get this thing out.
Yeah, he had told the nurse, I don't want, and she was like, you don't want that? Get it out. So if you're not familiar with this remdesivir, this drug got such a bad rap that nurses began to call it run, death is near, and rightfully so. And I knew this, and Lee knew this, and so obviously we knew to refuse it. But here's the kicker about this drug, is that it begins to shut down people's kidneys. And when it shuts down your kidneys can't process fluid. And you already have probably bronchitis or pneumonia if you're in the hospital. And they give you this antiviral drug, which it's way too late to be giving this drug to you in the first place. But when they do, it makes things worse because your lungs start to fill up with fluids because your kidneys start shutting down. And then they put you on a ventilator, and then you die.
Well, we need to back up because they didn't even ask me if I would receive remdesivir. They gave it to me without approval.
Here's what's wrong with that. Anytime anybody ever gives you a drug as a patient, it is their obligation to tell you what it is, how much they're giving you, and why it's been ordered. If you do not do this, it is not informed consent, and it is against healthcare regulations, especially in a hospital. That was the thing that was number one that was wrong with that. Number two, COVID had a blanket protocol. Everybody who had COVID was treated exactly the same. And typically it was supplemental oxygen, remdesivir, and a ventilator. That was it. And those were almost standing orders. You could come into a hospital, not see a physician, and this is what would be started for you. That's bad medicine. And nobody could stray outside those boundaries. That's bad medicine. I think you were so sick too that you were just wanting to feel better. Hey, and we trusted
Couldn't breathe.
Yeah, we're trusting the hospital here to help you, right? Not hurt you. When you find out that you're getting a drug that you don't want, it is quite unsettling, especially if you're already feeling junky.
Are you freaking kidding me? Get that drug out of your arm now. Oh my gosh, I freaked out. This is why they don't want people like me there. So he finally called the nurse and they stopped the IV.
This is months later. We get the hospital bill. So this is fast forward for a minute. So when you got remdesivir, it was a 5-day course. And each course was at least, do you remember how much it was, Lee? For one dose of remdesivir?
I think it was 5,000.
Close. It was 3,000. Depending on where you were, it could be between 3,000 and 3,500. But times 5. That is insanity. Do you remember what we found out when we got the bill from the hospital?
I just remember we asked for it to be removed because we didn't approve it.
Yes. Not only did they charge us for remdesivir, but they charged us 2 units.
Oh, that's true. Yeah, I remember that.
Of remdesivir.
Because I thought it was close to 5,000 we got off.
Yes.
Maybe 6,000.
Yeah, it was 6,000 that they had charged us. He didn't even get a full treatment of the remdesivir. I don't know, 5 minutes in his arm maybe. And then only to find out on a statement, not only did they charge you for 1 unit, but twice the amount. And the pure fact that they didn't fight us on taking this portion of the bill off is kind of telling and almost an admission of guilt. It just makes you begin to wonder, where else did they take liberties? I don't know. That was just the icing on the cake to find out that they had overcharged us. So this is where it gets interesting, because I then began to say, look, we don't want the remdesivir. What we do want is high dose vitamin C, IV through an IV, vitamin D, high dose through an IV. We want zinc. And this is where we began to hear the mantras. The healthcare worker, so I can only assume this was a nurse, said, we don't do that. You don't give vitamins to sick people? No, we don't have high dose vitamin C IV. What? And then I said, hey, we want antibiotics. Oh, we don't do that because, you don't treat COVID with antibiotics. Let me think about this. Somebody has pneumonia and you don't give them antibiotics. Yes, sure, there are 2 types, viral and bacterial, but chances are that you're going to get secondary opportunistic pneumonia as the result of having fluid in a warm, dark place. You think that might, start growing something called bacteria? Yes. And this is what we did before COVID happened and people lost their minds because they contracted medical amnesia and for some reason forgot how to treat opportunistic pneumonia, which is what
wasn't the COVID protocol.
There it is. That was the tagline. Anytime we asked for something, that's not the COVID protocol was the answer. Yeah. And that became really old very fast. And then at one point in time, when I was arguing with this nurse, she said, I said, well, this is what we want. And she said, what'd she say, Lee?
This is not Burger King where you get it your way or something like that.
No, she just said, okay, now you got to remember, I'm on the phone. All she said to me was, this isn't Burger King. And I was like, oh, yes, it is. Yes, it is. And you work for me, my friend. And this is what we want. It was just not great. It was not a great time. I hung up the phone eventually with Lee. My daughter had come out because she knew I was talking to him, and she said to me, this is something that Lee, I don't know that Lee knows, but she said to me, Mom, if Dad dies, are we moving? And I looked at her, what? I said, no, Dad is a fighter. He's not going anywhere. And she said, because I saw in the news about that lady and they wouldn't let her out and she died. And I was like, oh my gosh, it was a horrible, horrible time. because our kids were just, they're being homeschooled. They're unhappy being home. It was the first time in their life that they ever were homeschooled. And then it was a tidal wave, a tsunami of horrible, evil things that were oppressing our family.
ER doctor, supposedly, I don't know, I think might be a nurse. She comes in, and she goes, you don't want this? And no, we do not want this. I'm on speakerphone. I said, but what we would like, and I told her about the high doses of IV for zinc, D, and C. That's not COVID protocol. I don't care. We don't want the COVID protocol. We would like this to happen. And she goes, we don't do that. It's not part of the protocol. You don't give vitamins and supplements to your unhealthy patients. I'm not going to argue with you, ma'am. Yes, you are, because this is what we want. Well, this isn't like Burger King where, oh, yes, it is. You work for us. We tell you what we want. And if the protocol doesn't match up, it goes out the window. They weren't happy with me. I don't know what to say anymore. I seriously, I'm in the twilight zone right now. What the hell is happening? Oh my God. I just had conversations with both my children where they were both like, I want to go see Dad. I know, but they won't let you. Ask me, Mom, if Dad dies, are we going to move? She's like, I know what happened with that lady in the hospital where they wouldn't let her out. I'm afraid that's going to happen with Dad. Oh, this is a nightmare. Oh, sweet Jesus. I don't know what to say. It's only going to be Jesus. That's all I got to tell you right now. He's the only way right now.
What we ended up doing was smuggling drugs. I became a drug smuggler. Yes, I did. And I was very happy about it because at that night I had my son put together, we put together a bag for Lee because we knew he was going to be there at least overnight. I smuggled in HCQ and vitamins and probiotics, the things that sick people need.
Okay, so Lee called me and he goes, well, we're at an impasse. And I go, what? What does that mean? Well, you don't want to take remdesivir, so we just need to discharge you. Basically, if you don't want to follow our protocol, then, we can't help you kind of thing. Excuse me? What did his x-ray say? So she looks it up and she goes, oh, well, he has infiltrates in his lungs. So basically, they're going to call that COVID lung, right? So basically pneumonia. She goes, well, yeah, we don't know if it's COVID, viral pneumonia, or bacterial. I said, so we need to treat for the pneumonia. She goes, well, we can give him antibiotic, steroid, and continue the budesonide respiratory treatments and continue with the oxygen. Great, you can stay if you do that. But we're not taking the remdesivir anymore. Here's the kicker. The doctor goes, we checked with our pharmacist here in the hospital. They don't have any IV vitamins. And as a matter of fact, they checked throughout the entire state of Virginia. And the only place that might have it is a place in Richmond, Virginia. There's no IV vitamins available in the entire state of Virginia. Let that one sink in. Seriously? Wow. I guess you guys don't care about getting your patients better or care to pick up a research article to figure out what's really going to help them. And so then I said, fine, give it to him orally. Well, we can't give it to him at high doses orally. You can at least give him 1,000 units. No, we can only give him 500. I'm like, oh my gosh. It's like a children's multivitamin dosage. As of right now, he has been admitted to the hospital, but he's in the emergency room because they don't have a so-called COVID bed for him, which I asked Lee, where exactly is that going to be? Oh, it'd probably be in med surge. Okay, as long as it's not in ICU. And we're not here for you to make money off of us. Well, if you're admitted and his oxygen level is saturated above 90, where it was supposedly like 85 or 86, why aren't they giving you the antibody infusion? And the answer originally was, we don't do that in the emergency room, which if you remember back, when I took him for his treatment and dropped him off, they said come back in 2 hours. And then they called me 15 minutes later and said, we're taking him to the emergency room. He has to see a doctor in order to get the antibody infusion. That was incorrect information and obviously a lie. I don't care if they misspoke, didn't know what they were talking about. They lied. Yeah, so he's not getting that treatment.
About midnight that night, I get a phone call from Lee and he says, well, they want to transfer me. What do you think? This is like lie number 3, maybe.
And that was a lie too, because I was leaving. They had no room for me.
Yeah, well, they had told us that you could stay in the ER until a room opened up in the hospital. And the hospital that is in our hometown is like 5 minutes from us. Well, that wasn't the case. At first, it was as if it was a choice. And then we realized, oh, it's either get transferred or go home. Well, we should have taken home, quite honestly. But Lee was just not doing well. And this hospital that he was being transferred to was an hour away.
I was whisked away in the deep of night.
Yes. Okay, so imagine this person that is extremely sick, has immune issues, and they say, hey, we're going to transfer you. They take him at 1:30 in the morning. He travels to hospital an hour away. By the time he gets fully admitted into a room, it's 4:30 in the morning. Now, no sleep, no food, no IV. He wasn't given fluids, he was not given food, and he was not allowed.
never given IVs.
And
whole
no,
time I was
you
in the
weren't.
hospital.
That is another major issue. Another major issue. We'll talk about why that was huge too. Unbelievable. Great way of treating a sick person. Let's just put more stress on their body that's trying to heal.
Unbelievable how supposedly it's all about the patient's health when it's not at all. Nothing is about patient health right now. It's all stacked against patients. And I'm somebody who's educated. I don't know what people do. They just are blindly led by these people, and nobody questions them. And let me tell you, when you question a doctor, you challenge them one time, wow, they lose their sauce. They lose it. They become a hot mess. Like, dude, do you pick up a research article at least once in your life? If you did, you wouldn't be arguing with me.
And this brings us to, so what? So what, Dr. Toe? Well, the so what is this. You and I must never grow tired of fighting for what we believe is right, fighting for what we know is true, and fighting against what we know is evil. No matter the consequence, we must stand up, and we must never allow these atrocities to be repeated. Only you and I can stand against this evil, because we will remember our stories and the past atrocities that were perpetrated on our loved ones. Better to die on your feet than live on your knees. Well, that's a wrap. If you like what you heard, please share. If you'd like to hear more, please subscribe. And if you're a faithful listener, thank you for all your support and love, because without you, I would not be here. I'm glad you are along on this journey with me. We have each other, and we are not alone. Stay tuned for the next Dr. Toe Talks episode, where we continue our story of the hospital ovens and patient prisoners. Pursue health, live free, and breathe deep. Until next time, everyone, this is Dr. Toe signing off. Important disclaimer. This podcast is presented solely for educational and entertainment purposes. I am not a medical doctor, and I do not diagnose, advise, or treat. This podcast is not intended for the substitute of advice from a personal physician, professional coach, psychotherapist, or other qualified professional. It is not intended to be used or relied upon for any diagnostic or treatment purposes, or to be used as a substitute for professional diagnosis, treatment, or conventional medical therapy. None of the statements made in this podcast have been evaluated by the Food and Drug Administration. Please consult your healthcare provider before making any healthcare decisions or for guidance about specific medical conditions. Listen responsibly.